Okay, so today we are at the Laser Spine Institute that is located near the Tampa International Airport in Tampa, Florida. So it will do this rotate by myself or by itself when I'm not doing it. So it's going to give us a little walkthrough. We may not be able to get through all these little sections today. We'll try, but we can also jump around here at the bottom. That's what I said, even, for billing and coding students, this isn't necessarily it, but, check-in is usually where we have that billing point at too at some parts. I don't know if we'll see more of the, behind the scenes business side of the Institute. I do see we have some scheduling coordinators down here and stuff. So, but the waiting area, I feel like this is pretty self-explanatory. Try to slow down for everybody. But it just wants to give you that real.
Cassandra?
Yes.
Yeah, billing and coding students could be doing front end as well as medical assisting admin, and we could also be doing the scheduling.
Yeah, and we'll get to scheduling up here in just a second. So I think we're starting off. So this is it for the waiting room. And it does say, it has its little, so during your streamlined surgical process at the Laser Spine Institute, you will begin your path to wellness by checking in on the third floor of our Tampa Surgery Center. Our friendly staff will help you during your time in Tampa and will direct you to your daily appointments. So now we'll go to that clinic exam room, and this is, see if I can zoom. I don't think I can zoom out a little bit. I was like, we're a little close to this couple here, so I'd rather see more of the room. So there is your exam bed. More than likely, these are the, darkened windows, so, onlookers can't see in, but it does kind of give you a less clinical feel than most operating rooms. I know whenever I'm in a hospital room, it's a little closed. So I do like the environment aspect of this. The Laser Spine Institute's Tampa Surgery Center features 13 clinical exam rooms on the 4th floor where you will have your initial consultation and all necessary pre- and post-operative appointments during your time at our facility. Caregivers are welcome to accompany you in these rooms while you review your MRI with your physician or receive your physical exam. So it looks like they're possibly in the review process, and there we have that. So you have your x-rays here behind the physician, and he has them also pulled up on the camera, on the computer here. So it says, what is an annual tear? It's actually going to go in. It might play this video. The audio is sometimes a little spotty, but fingers crossed, we'll see. No, hold on just a second. I'm going to turn the captions on, hopefully, and then I'll mute it. So this might give us some, there we go. Sorry, it's so quiet. So I'm sure a lot of us have maybe even suffered from this, so I kind of like that they go over that. How many of us probably complain of lower back pain? I'm one of those people, so more than likely this could be even something I have dealt with in the past. So they're going into the procedures they do, the laser, and how they use the laser here at the Spine Institute to repair these tears. And so if you saw the word stem cells in the last, they're actually using the human body's own stem cells. So you do have some stem cells yourself. I know there's a lot of confusion and often controversy that surrounds that term stem cells, so I just wanted to clarify. And so that was a little, be it quiet. I apologize for having you guys having to read, but it's better than it lagging that whole time. Okay, so next is the patient cafe. I think these are really interesting, even though you're like, why is this on the tour? Well, if you were here visiting for an actual field trip, this would probably be one of the most exciting places you were at, because often people get hungry. You know, everyone wants to check out the hangout spot. So when you're on a real tour, like when we went to the zoo, I always loved seeing the animals, but I couldn't wait to eat in the cafe as well, just because it was something different and new. So you can relax with your family or caregiver, enjoy a catered breakfast and lunch, or surf the web while waiting in our professional, comfortable area. So this in the what we're using is virtually anywhere. This particular website, I think, is for client services, as a way for these businesses to kind of sell themselves during COVID-19 for investors and other things like that. So you very much get that customer service kind of descriptions with a lot of these. It'll let me go to the next one. Okay, so here's the Spinal Diagnostic Center. Spinal Diagnostics is a vision of the Laser Spine Institute established to service the preoperative needs of patients with the primary goal of optimizing surgical outcomes. Some patients have pain in multiple areas, which requires additional evaluation at our Spinal Diagnostic Center prior to receiving a surgical order. So sometimes you have to go here first, basically. Some of the diagnostic procedures performed are diagnostic facet injections, selective nerve root block, and discograms, as well as MRIs and X-rays. And so again, this could be a check-in person or a nurse. It varies, but this could also be another role for that billing and coding student or medical assisting admin. And again, it's another smaller waiting room, but we'll go back to the actual suite now. So we're going to tour an MRI suite. And so they almost put you in the machine, right? But if you haven't seen an MRI machine, here's a good example of one. To me, it does look like something from the future. It's very big. The lights are a big deal. Anytime I've been in one, it very much feels like a scene out of like a very old sci-fi movie. So we offer a convenient on-site MRI unit for those who need an updated MRI, or if their symptoms change, your MRI will be reviewed with our physicians after all necessary tests are performed to pinpoint the location on your spine that will be operated on. Our skilled and knowledgeable physicians use an MRI in conjunction with the patient's explanation of symptoms to treat the source of the pain in their spine. So this is where you have your operator and they're behind the mesh screen to protect them from the radiation. And then over here, you have your station for positioning. So it's pretty small room for a reason. And then here's a picture of their X-ray suite. So we provide an X-ray service to you to better understand your condition and help us determine if you are a candidate for our endoscopic procedures. X-rays are an integral part of our diagnostic process and partner with an MRI and other ordered tests. So you don't have the 360 tour of this one, but we still get to see it. So here we're at that scheduling and coordinators part again. And I would say this would probably be your biggest point for billing and coding. I had to speak to someone before I had my gallbladder surgery, And I was like, yeah, this, it was really helpful, but it's more than that's what's like, I don't know if this is something Miss Foley has talked on, but billing and coding is a lot more than the computer stuff. So it's a lot more than all that billing and coding. So yes, this is just a view of her office, but it still gives you an idea of all the points you would have to go through, should you need surgery, or if you were ever wanting to consider working in a place like this. So I'll see it before we go on. We'll see what it says. Our scheduling coordinators will serve as your concierge through the streamlined patient experience at the Laser Spine Institute. Once surgery is ordered by our physicians, you will meet with one of our knowledgeable scheduling coordinators who will guide you through the remainder of your surgical process. We're going to pre-op next. So this is the preoperative area. I'll go ahead and start with their description. On the day of your surgery at our Tampa Surgery Center, you will be escorted to our preoperative area. In this area, you will meet your surgeon and anesthesiologist. Your surgical procedure will be reviewed and you will be prepared for surgery. If you have any additional questions, your surgeon can answer them at this time. And this is probably one of the larger rooms we can take a look at. You can see the different models they have out to kind of help with consultation even before surgery if there's still questions. And the difference, so these beds aren't laid out all the way, but I do assume they would also extend to beds here. So they're just kind of put up right now. It's not going to let us go around this corner here. It'll take us on to the next part. So this is where we start. You can see the x-rays at the back. So if you see these back little TVs and stuff behind this gentleman, all these could be, the different cases they have. They could be prepped for operations tomorrow, but these are more likely your active patients, I would assume, on the wall that's behind them. Trying to get to the operating room. Then we have one more. Okay. So here we have your operating room. I really like these labels here because it gives you guys a better idea of, what's needed. So Laser Spine Institute has a state-of-the-art operating rooms that include Holloman lasers, high-definition endoscopic cameras, and video monitors, in-room picture archiving and communication system, PACS, viewing monitors for MRI and X-ray image displays, portable C-arm fluoroscopy with image push capability to the PACS, meaning they can take pictures when it's inside your body. System and electronic charting. With our innovative surgical staff, we are able to stay ahead of the curve on technological advancements. All of our surgeons specialize exclusively in our minimally invasive outpatient procedures. Trying to get that to go away. Okay. So we're offline right now on this monitor. I just wanted to, in case no one knew, that's what that was like. So here's an example of one of their lasers. So this is the entire piece. Gonna try to go slow for this one. If I use the buttons on my mouse, it does it so fast. So I've got to click and drag. So there's your spine. Yeah, it took me a minute to see. So it looks like the two side views of what the tear could be. Assuming this is a type of x-ray right here. If I'm mistaken, and if anyone else knows, just butt in and get me and correct me, please. Some of this technology looks so new that I'm like, wow, I really don't know what that is. And then the medications and all your different syringes and stuff, like I said, it was nice to just see what they need in their operating room so you guys have a good idea of that. Huge lights. I don't think you can ever have enough light in an operating room. And lastly, we're going to go to the post-operative area here. And so this is where you go once your surgery is over. So after operation, Laser Spine Institute nursing staff will transport you into our restful recovery area. During this time, our medical staff will monitor your vitals and ensure your comfort during your immediate post-operative recovery. Your caregivers will be waiting for you in the next area, the recuperation area. So I've never heard of a recuperation area, and it's actually not on this tour, I don't think, unless it's going to let me go. No. So that was just kind of funny. I was like, well, I don't see a recuperative area, but most of us are probably a little familiar with a post-operative area. Yes, it's going to still have the same features as pre-op and even surgery. You have beds, monitors, and all that, but you also kind of have your admin area over here as well. So depending on the surgery, you know very well at this post-operative area, you could take care of billing and coding needs as well. That's sometimes a thing, not all the time, but it's a possibility, especially depending on the size of the hospital. With this being the last bit of the tour, I don't know if anyone has any questions, would like to go back and look at anything, or have any comments. So you're free to take yourself off mute if you would like to have a little discussion. This one is a little bit shorter than some of their other tours they have on here, but I still liked it. Gave a really good in-depth look at this Laser Spine Institute. So
Rebecca, I know that you are MA clinical. Do you have any specific questions?
No, I don't have any particular questions other than, you know, this is a virtual tour. You know, are there going to be any chances to actually go to any like real trips?
I would say no because of COVID-19 right now, Rebecca. Yeah. So we don't have campus open for that same reason. We can't do physical field trips right now either.
Yeah, currently we can't because of COVID-19. There is a hope one day soon, maybe, but not right now. Currently, no. Is there a specific specialty that you would like to tour?
Children's hospital.
That's in 3 weeks. It will be virtual also, but and I actually did it a few weeks ago. There's already a recording of the Children's Hospital on the LRC YouTube page. But yeah, we'll be doing that in just a few weeks.
Okay.
Yeah, on the 18th of February. So a month from now.
That would be a good one for you to attend.
And that's something like, I mean, I can always, you know, send a message to your instructors that you attended this, but I'm also trying to reach out to instructors more to let them, you know, try to use this as a way to help you guys as well. So the goal would be for all medical students to be on that 2-18 one. We'll see, but my goal would be for all of you guys to be on that virtual call. So that way everybody can see the hospital.
Right, of course.
Well, if there's no more questions, I'm going to go ahead and stop the recording right now and go ahead and we can all just say bye to everybody. I'll be posting all this stuff on YouTube. So that was a great question, and I want to actually include that because if anyone watches this, they have that little answer. So about field trips and when can we get to do those again. So thank you guys for coming. Also, I don't have much else, so if you're free to go at this point as well. So I'm going to go ahead and stop recording now.
All right. Thank you.
Okay.
Thank you.
Thanks. Bye.
Bye.